Hello, everybody. So for today's presentation, I'm gonna go over lovastatin and its collateral biosynthesis. So what exactly is lovastatin? So basically, it is a cholesterol and triglyceride, which is fat-lowering drug, which is developed by Merck Pharmaceuticals. So basically, this is used to lower the fat and cholesterol levels in blood. And this medication works great for patients who present or have risk for medical problems, such as chest pain, heart attacks, and strokes, and a few more as well. So patients that have any risk of heart disease, things like that, this medication works great for. Obviously, they need to be prescribed by a physician. And what is lovastatin continued? So basically, some medical problems are caused by fat clogging in the blood vessels, and this develops over time. Sometimes it's the food you eat, and it could be a lot of different reasons for that. So basically, um, this medication is used to prevent certain types of heart and blood vessel problems with patients at risk, as I mentioned earlier. And basically, lovastatin belongs to a group of medicines that are called HMG CoA reductase inhibitors. They basically block an enzyme that the body needs to make cholesterol, hence lowering its levels in the blood. Now, as for its cholesterol biosynthesis pathway, it is used specifically in a mevalonate pathway, which I'm going to go over a little bit more in detail in a minute. And basically, this is a crucial metabolic pathway which synthesizes cholesterol as well as other hormones and molecules. It is usually occurring in the cytoplasm of cells, primarily in the liver. Now, these are the different steps for collateral synthesis. So basically, the first step is it goes from acetyl-CoA to HMG-CoA, and basically the acetyl-CoA molecules combine to form 3-hydroxy 3-methyl glutarol CoA, which is also known as HMG CoA. From there, it goes from the HMG CoA to the mevalonate. The enzyme HMG CoA reductase converts the AMG CoA into the mevalonate. Now, the mevalonate um, goes to the isoprenoids, and basically the mevalonate undergoes phosphorylation and decarboxylation to form isopentenyl pyrophosphate, for short it's IPP, which is a 5-carbon building block. And then from there, the isoprenoids go to squalene. The IPP units condense to form squalene, which is a 30-carbon linear precursor. And then from squalene to lanosterol, and then from there to cholesterol. And then basically squalene undergoes cyclization to lanosterol, which is then modified through multiple steps to produce cholesterol. So this is the summarized version of it. And basically, HMG-CoA reductase is the rate-limiting enzyme, and it is the target of statin drugs, which lowers cholesterol levels by inhibiting this enzyme. So it makes the body create less cholesterol, for short. Now, what are the effects of lovastatin on cholesterol levels? So lovastatin is a prodrug that needs activation. And then basically by inhibiting HMG-CoA reductase, the liver compensates by increasing LDL receptor expression, which leads to more LDL clearance from the blood. And basically this lowers the total cholesterol and LDL levels. Now, the reduction, the positive effects is that it lowers the risk of strokes, atherosclerosis, and heart attacks. As for the structural activation of lovastatin, it is administered in a lactone, which is also known as an inactive form. However, the liver enzymes hydrolyze the lactone ring, converting it to active B-hydroxyl acid form. And this structural change is essential for it to mimic HMG-CoA and inhibit the enzyme. So to conclude this presentation, Lovastatin effectively reduces cholesterol by blocking its biosynthesis altogether and increasing the LDL clearance. So effectively, it makes less cholesterol and LDLB in the blood. This medicine works great for patients with at risk of heart diseases or that already have heart diseases, such as strokes, atherosclerosis, and many more as well. As all medications, it does have some potential side effects, which includes muscle pain, liver enzyme elevation, and rare rhabdomyolysis. So this is something that will have to be, spoken with a doctor and see if it is beneficial for the patient, considering all the side effects and many more. So this concludes my presentation. Here's the works cited. Thank you and hope you have a great day.